2 days in since the news broke of what's now been described as the most explosive outbreak of meningitis in decades, and the demand for precautionary antibiotics in Kent is unrelenting. 4 of the 15 known cases have now been confirmed as Men B, the most dangerous bacterial form of the disease that can lead to sepsis and death, and which most teenagers and young people have not been vaccinated against.
This is an unprecedented outbreak. It is also a rapidly developing situation.
The Health Secretary said he's asking the government's Vaccine Advisory Committee to review eligibility for meningitis vaccines to potentially include this age group, but for now they are targeting those in Kent.
Given the severity of the situation, I can confirm to the House that we will begin a targeted vaccination programme for students living in halls of residence at the University of Kent in Canterbury, which will begin in the coming days. UKHSA will provide further advice on other cohorts in the coming days.
This is the nightclub thought to be at the centre of many of the cases, a potential super spreader event 2 weekends ago, now being flagged to attendees to take precautionary antibiotics. 3 more sites have opened to distribute them, the authorities pressing the case that this is the most effective way to stop this outbreak.
One of my friends is went back home showing symptoms. He's going to be in hospital for supposedly a couple of nights, so still close to home.
Now they've identified the strain, and it's a strain that a lot of people will not be vaccinated against. So hopefully, something can be done to prevent this from happening again.
Such is the urgency of the situation. Officials describe having to learn about it as they go, but they aren't ruling out a variant of the usual Men B infection.
We don't quite yet know what is causing this particular, as said, unprecedented status. Hypothetically, it could be that this is a slightly different serotype, different type of the meningitis bacteria that evades immunity a bit more easily. That's something that the laboratory testing and the genomics will tell us over the coming days.
And these coming days will also be critical to contain the outbreak, but authorities are facing an uphill battle. Today we also learned that 2 University of Kent students had already travelled to London and France before later testing positive for the infection.